Everyone. Thank you so much for joining us today. And I'd like to thank all of our presenters for their excellent presentations and all the work that they're doing to improve the lives of houseless people in their communities. Now we'll go to questions. Please enter any questions in the Q&A section. The first one is curious about whether there's a connection to health services incorporated into these response strategies beyond emergency services.
So maybe Jacob and I can answer some of that. Just let me know because we're wearing our masks if you can hear us. So there's an outreach van that currently goes out right now in the city of Winnipeg that is very harm reduction focused called Street Connections, but also Jacob and our outreach team have been participating in an Indigenous-led vaccine strategy, in which case we have been taking the vaccines right to encampments and people who are street involved and living roughly. And one of the benefits to that model has been the treatment of acute and other medical conditions in addition to the vaccine outreach. So we're actually finding that we're doing more wound care and triaging back to primary care, because we're also partnering with Aboriginal Health and Wellness, which is a community group here that is also has a primary care clinic. So we're looking at how to now sustain that model beyond vaccine outreach, because it's really about taking the services to people. And we do know that, like in other places, I think it's Toronto and other jurisdictions, they do have health buses that function like that. But in Winnipeg specifically, that's the only model right now.
Any other of our presenters like to add to that?
I can just add that there's a new outreach initiative called the Downtown Community Safety Partnership. And they have a 24/7 team that's trained in first aid. So one of their goals is also to divert calls from police and paramedics when those services aren't necessary. So they have a bit of a broader mandate than just supporting people who are unsheltered or in encampments, but they do have a 24-hour team in the downtown that provides first aid. And the health authority has a team of staff called the Hawks team, and they will also provide direct outreach to individuals to try to connect them with housing and healthcare supports. And it's specifically oriented to people that are presenting with kind of complex mental and physical health needs and experiencing homelessness.
I'll just add quickly, for us in Hamilton, it's a bit of a loose organization, I would say, where we have my organization that I work closest with, Marcy as well, it's on the call here, is HamSmart, which is the Hamilton Social Medicine Response Team. And so we work closely with a group called Keeping Six, which is an organization of people who use drugs, who are doing outreach into the encampments in Hamilton. Marcy leads a lot of that. And so through that, a lot of health needs, both mental health, substance use disorders, physical ailments are identified. And then Marcy is in touch with us on HamSmart's, on the HamSmart side, on the medical side. I'm an infectious disease physician, and we have 2 primary care physicians as well that will go out with Marcy to see people where they are. And then we also have in Hamilton the Shelter Health Network, which provides medical care within the shelters themselves. And so that's another touch point for people in terms of accessing care.
Excellent, thank you. The next question asks, how does the recent court ruling impact the strategy and approach? Does this change the status of rights regarding housing?
I'm going to pass that one to Marcy.
All right, I'm guessing we're talking about the court ruling in Hamilton. So I don't think it changes the rights. I don't think it increases access. Sadly, I talk to people in encampments on a daily basis. That's not the sad part. The sad part is yesterday and this morning I've been in encampments since the ruling was made that they will go back to strict enforcement of no camping bylaw. And people ask what they're going to get in exchange when they give up their tent. And I had to answer them with nothing, because there's not really adequate shelter space. We There's people I tried to get into shelter today, and shelters are full. I believe yesterday we tried to get someone in that had some like medical needs and some other needs and wasn't able to. I've heard stories of recently of people sleeping in office buildings supported by people because there's no space in the shelter system or housing sector. So I don't think it changes the right. It doesn't increase sadly, it does not increase the opportunity for shelter. It simply removes people's privacy and dignity, in my opinion.
Yeah, and I'll just add to that in terms of the medical piece, which was like leading out of the first question, it makes it much harder to do any of the medical outreach for sure. So one of the, again, it sort of goes without saying, but we have to say it over and over again because it kind of gets painted this way in the media by other people. But we're not happy that people are living in tents and parks. We definitely wish that people had better options than that. But the fact that we know where people are and we know where to find them week by week has certainly helped us stay in touch with people, make sure that follow-up happens for medical issues when we do see them, make sure we know where to find them if we need to bring them for tests or for other appointments. So there's definitely a sense of foreboding on a number of different fronts with the court ruling yesterday. But from my side, which is kind of focused on the medical side, I'm extremely worried about a lot of my patients that are extremely unwell, and I don't know where they're going to be and how we're going to track them down and find them.
And I think if I can add back, sorry, I don't mean to like jump and monopolize the thing, but as someone, I personally have lived in encampments. I think some people on this call know the people I work with. Throughout my life, I've been housed for the past 6 years. Humbly and gratefully, I am privileged. And I need to remind myself that I have privilege over those people. Just because I have the same history doesn't mean I'm not privileged. And I always had the right to housing, and it was by people not taking my tent away that I was able to become housed. If that makes sense, I don't know.
And you know what, Main Street Project operates Winnipeg's low barrier shelter. And when we talk about this strategy, we are very clear about distinguishing the fact that shelter is not the answer for people in encampments, right? Quite often that's synonymously used interchangeably. There's room in shelters. Why can't people live in encampments and move them into shelters? That's not an exit for everybody from homelessness. Like housing is the true exit, not the shelter system. So when Chris and Jacob and I quite often talk to people about the education about encampments, we're very clear that housing strategies are what people living in encampments want. Self-determined housing strategies, not there's room in the shelter, let's move you. So for some people, that's a great option if that's what they identify. But we definitely, when we do our education piece, stress that that's not the exit to work with people in encampments. So.
And I think, like Marcy suggested, the way to connect people with those options, which are right now few and far between, we have a bit of a housing crisis in our city. It takes time. And, displacing people from their location just makes it harder for their support network to find them. It disrupts stability, relationships. It puts enormous strains on people's mental and physical health. So having a system now, however imperfect, where people are explicitly allowed to stay on public property, while adhering to some basic kind of life safety considerations, helps a lot to develop those relationships that can actually open the door to meaningful alternatives that people might want.
Yeah. So I just would like to add that it's really difficult. So I'm a peer advocate. I'm an outreach worker. My job, my passion is to go and help my family who is still living unsheltered, honestly. I've been clean for 21 years and housed. But it's hard to do our job when we have all these different outside agencies, outside forces, city government, both provincial and federal, coming at us with different directions that are not suitable for the community. And the community does not it's just not good for them. So it's about building trust, and it takes time to get to know this community. Yeah, I just wanted to throw that in and treat people like people.
Thank you to all of you. And the next question is, have there been any alternatives to middle-class housing, in quotes, that you have seen achieve success in providing alternative housing options for individuals who prefer encampment living would have better success in alternative housing?
Based on the first recommendation of Gagita Oma and Homelessness Winnipeg, did an engagement of people living in encampments specifically around housing wants, needs, and preferences. And overwhelmingly, we heard that people were not looking for an apartment. They wanted like a tiny cabin or a tiny home in community. Shared housing was also put forward as an alternative. So we've worked to advance this idea. It also, the village idea aligned a lot with what we had heard from local elders and from broader consultations with First Nations people in Winnipeg, looking at how to end Indigenous homelessness. So this idea is materialized now into Astamapinikanak, which is currently under construction. Will be a village of 22 tiny homes near Thunderbird House in the center of the city, and they're going to be taking tenants in January, February. So there's wraparound supports and a harm reduction model for that housing, but of course it's going to take time to monitor and evaluate the outcomes of the folks that move in there. But what we do know is that it's grounded in community, it's grounded in teachings from our local elders, and it's designed to meet the self-described needs of the people that were in encampments and what they wanted to see in terms of housing options that currently we don't have. So hopefully that'll be a promising model that can scale.
Does anyone else want to speak to that question?
I love the idea like that you took of actually going to people and asking what they need or what they want for housing. Because like so many times programs are created without input and without anything. I know a few people I work with that have been housed that in wraparound supportive housing that doesn't meet what they need, and they're still struggling and they're facing eviction 6 months later, 4 months later, because the supports offered aren't the supports they need or aren't entirely accessible. It's more like they told me I had to be here, so I'm here, but it's not working, and now I'm gonna be on the street again.
Yeah, just to go off with what Marcy was saying, a lot of encampment residents have been housed in market rent units, so they're not really provided a choice or option. The housing worker just gets them a unit, puts them in it, and then there's not really any support or follow-up after. So it can be really hard to maintain that housing and be successful in your housing when you don't have that support and you're kind of isolated. So I think it's really important for people to have a say in their housing and have that autonomy to choose where they want to live and what kind of support they want to have, and not be forced to use certain supports that might be on site wherever they move into. So I think having that engagement and autonomy is really important.
Thank you. Our next question is, I'm wondering if there is much evidence or research yet into the barrier of discrimination against folks seeking housing due to being connected to social services, such as rent subsidy programs. While there are many new rental subsidy programs being offered, in my experience as a housing worker for folks experiencing homelessness, I have had a very difficult time getting landlord buy-in. I can echo that myself.
Yeah, we've had like a rent assist subsidy program in Manitoba for some time, but we just a couple months ago launched a new benefit to stack with it to help people actually afford housing. And it's a slow process for uptake. I think we also in Winnipeg, you know, at least 2/3 of the people experiencing homelessness are Indigenous, and we did a street health study in 2018, and a quarter of the respondents said that they had faced racism and discrimination trying to access housing, and that was a barrier for them. So you couple the stigma and prejudices people have about poverty or social assistance benefits with systemic racism. And yeah, it is a barrier. And again, it points to the need for housing that is designed and operated by and for Indigenous people in Winnipeg's situation particularly, but the demographics of that will change from community to community.
Hello, me again. So here in Winnipeg, at least, I see less ads in the newspaper for housing as the years go on, and more ads on social media sites. And below 90% of them, they say will not accept people on EIA or welfare, whatever term they use. So it's still going on. It's been going on since I was a kid. And unfortunately, people just, yeah, it's just going to keep going on until we make some kind of massive change with every system involving unsheltered people from the ground up.
Thanks. Another question, do you have advice or best practices for supporting folks who don't want to access shelters over winter or in extreme weather?
So in addition to co-chairing the Gagina Oma strategy to support unsheltered Winnipeggers, Adrian and I co-chair the Extreme Weather Response Committee, which brings people across homeless serving sectors to design a plan for responding to adverse weather conditions that's homeless centered, focused on people who may be at greater risk of exposure due to being outside for a long time. And of course, Winnipeg has an extremely harsh climate. Managing extreme cold is a big part of that plan. It really is about outreach, tons of safe rides, like being out there to meet people's needs and offer supports and offer connections to shelter, active monitoring of shelters and safe spaces. We're still at the step of trying to negotiate a more sustainable funding strategy across the different levels and bodies that have resources to create more sustainable funding for organizations to be able to adapt really meaningfully to extreme weather. But we're definitely making progress in terms of like ensuring that there's 24-hour coverage of outreach services, ensuring that there's a variety of options of shelters and safe spaces and monitoring capacity across those spaces so that, people that want to access shelter can have hopefully someplace warm to go. We had a great community initiative startup last year, volunteers that was like a community caring camps. This was an outdoor location that offered like warming teepees, tents, fires, cultural supports. So it was and warm clothing, food. So that's another way of meeting people's immediate needs. It wasn't like an encampment or a designated encampment site. It was a cultural warming space for folks. And Indigenous partners in that are hoping to kind of scale that up into broader initiatives for outreach and supports for the community during cold weather. But if you go to nlsswinnipeg.ca, you can see that extreme weather response plan, which is very, very oriented to that community. I don't know, Adrian, if you have stuff to add.
I was just gonna mention that part of the strategy and one of the most important pieces, as well as the direct outreach portion, is the education and communication strategy. Not only are we working really hard to build trust with the people who are living roughly, but we are working equally as hard to educate and communicate with the people who live around those people in the homes, the city councilors who represent the areas. We spend a lot of time triaging calls about people who are living roughly and the perceived safety calls, the perceived threat of people living outdoors, and then how we educate those people about the systemic oppressions, the lack of housing, the people, when they call 311, they tend to think my job has been done and now the encampment will disappear. And for us, it's just I'm like, Marcy, I'm sure you have the same experience, but for us, it's just the first time Jacob's going to go say hi and offer a cup of coffee. Never mind have any discussion about next steps. Like, so that building relationship piece comes hand in hand with educating the public about poverty, stigma, living roughly, and also buying us the time, because the more people who are vocal about their perceived impacts on their surroundings and environment, the less time we have to build those relationships through direct outreach because of those pressures Jacob was talking about. So in the Kikanalma strategy, one of the things we talk about is communication and education for the general public, for the City of Winnipeg councillors, for the City of Winnipeg Parks and Public Works, for all of these people who, I'm going to use the word affected, but are also affected or in communication with people living roughly. So equal amounts of time building relationships all over the place, but that's, we see the calls to 311 and the calls come in, like we see the patterns through the years as the weather becomes colder and people are outside less, those calls dissipate over the winter, but they're changed to people now in bus shacks and people who are living roughly in a different way. And then they kind of dip off, and then come spring when there's that natural exodus from shelters where people have chosen to stay in shelters because it's a means of survival. And then they move back into encampments in the spring. Then we see the calls raise again. So it's really important that we also have a strategy to just make sure that everybody knows what the role of Kikanalma, what the role of the outreach worker is, and what the systemic issues are that are keeping people living roughly.
Thank you. That brings us to 12:30 and we have no more questions. So I will close this session. Thank you again to all of the presenters, everyone who asked questions, and all of you who attended. You guys are doing great work, and it's really great to hear more about it. Thank you.